Discussing the tic disorders, how do you define basically a tic? It's again a sudden, repetitive, rhythmic, involuntary movement that is performed by the person, which we regard as to be the tic in that particular person. So there are these particular symptoms of the tic disorder that the person is suffering from. So one should know how to distinguish these tic disorders, how to diagnose these tic disorders. Again, there is a diagnostic criteria that has to be followed when you are diagnosing a person to be suffering from the tic disorders. We have a range of tic disorders that are quite frequently reported to the clinicians or to the psychiatrists, and that basically includes the Tourette syndrome. On one hand, we have the transient vocal tics disorder, we have the transient motor tic disorders, we have the other disorders which are not quite specified into these categories. So these are the range of tic disorders that are present. The repetitive phonations, the vocal tics are on the one hand, which basically includes simple phonations, and then we have the complex phonations on the other hand, that basically includes the echopraxia and the copropraxia that we've already discussed and gone through. And then we have the motor tic varieties, and these variants basically includes the simple motor variant tics, and then we have the complex motor tics that are present in these individuals. So knowing these tics and knowing the symptomatologies of these tic disorders, what are the comorbidities that can be present along with these tic disorders, are quite interesting, and one should know the details to that. Now, we have another terminology that is quite frequently used and is known as the lalias. Lalias are the complex phonations that are produced by the person on the repetitive, again, they're repetitive, sudden, they are involuntary in their action, and they're present in that person who is suffering from the tic disorder. And usually it is one of the prime symptomatology that is present in the person. History taking is again very important, and one should also know the history to this tic disorder. How was it diagnosed in the past, and who were the scientists who worked in the development of the diagnosis and again the treatment guidelines, who worked on this tic disorder, who researched on this tic disorder. That will be discussed over here in this third section. And then we will be moving on to the onset of this tic disorder. What are the causative factors, what are the risk factors that basically leads to the development of the onset of this tic disorder in the patients. So when we say lalias, they are basically considered to be the complex vocal tics that are performed by the person. And then we have the palilalias, that is basically the repeating one's own words or one's own sounds. Then we have the echolalia, that is basically repeating the last heard sound, word or phrase, usually of a person to whom that a person with a tic disorder is communicating. So this condition is known as the echolalia, in which he's repeating the last heard sound. And on the other hand, if he's repeating his own words, that is known as pallilalia. So we have the coprolalia, on the other hand, sudden inappropriate expression of the socially unacceptable word or phrases. Usually they're confined to as the vulgar variety of the words or phrases that are uttered by such person who has that particular disorder of the coprolalia. So they may include the obscenities, specific ethnic, racial, or the religious slurs that are usually produced or uttered to that person. And then they're usually found in less than 10% of the individuals with tic disorders. So these are the different variants of the different phonations or uttering the different sorts of words by the person, and this condition is basically known as the lalias that are performed by that particular person. So usually this terminology is used when you're documenting the history or documenting the notes. You're taking the notes of the person who is suffering from the tic disorder. You are communicating with them, and then you are focusing on these particular kind of phonations that he or she is producing. History of Tourette's. First case was reported by Itard in 1825 and is a described case of Marcus D. Dampire. The woman of nobility important in her time, and she suffered the motor tics, coprolalia, echolalia from the age of 7. So it is basically, it was diagnosed at a very young, at a very tender age. So these were the conditions that were seen in this particular lady, which is known, she was basically suffering from motor tics, coprolalia, and echolalia on the other hand. Tourette wrote, more she herself thinks her vulgarities will be revolting, more she is tortured by the fear that she will utter them. So basically she feared uttering those words but still couldn't stop uttering them. So this was the phenomena that was observed in that particular lady of that old times. George Gillespie Tourette again worked a lot for the development of this tic disorder, for the research work that was carried on these tic disorder, and that is why this Tourette syndrome was named after him. In 1885, Tourette described the 9 cases with syndrome that now carries his name. So one of his cases was Marcus D. Dampire, and throughout much of the 20th century, Tourette was believed to have psychogenic origin. More recent research resulted in return to the Tourette's initial impression of disorder, known as non-progressive, hereditary, and a neurological condition. So these were the characteristics that were defined by the George Gillespie Tourette at that time, that this condition is basically hereditary, it's neurological, and it's basically non-progressive in its characteristics over here. The onset begins with a simple motor tics on the face, that is usually the blinking phenomena. Tics persist and generalize to the other parts of the body as well. Waxing and waning is typical in these kind of tics. Vocalization ensues, sniffing, snorting, and throat clearing is also observed in these people, barking, hiccuping, or uttering the nonsense words. And then they are typically explosive. So usually they'll be calm, they'll be peaceful, and then they're explosive in those tics phenomena. These are the hiccuping or the uttering the nonsense words, which was already termed as the coprolalia, is sometimes quite frequently observed in these people. The urges and the premonitions, they basically include tics generally experienced as irreversible but can be suppressed by the various time lengths. Some children are not even aware of their tics phenomena. With age, premonitory urge may arise and rising tension or somatic sensation relieved when the tic occurs. So this is the urge or the premonitions that the child is suffering from over here. I guess it's sort of an aching feeling in the limb or the body area or in the throat if it precedes vocalization. So this is the common statement that is given by such children. And then if I don't relieve it, it drives me crazy or begins to hurt in that way. It's both mental or in the physical extent as well. A need to tic is an intense feeling that unless I tic or twitch, I feel as if I'm going to burst. Unless I physically tic, all of the mental thoughts center on the tickling until I'm able to let it out. And it's a terrible urge that needs to be satisfied. So this is the range of the statements that is usually given by the patient. And this is how you basically identify that patient to be suffering from the tic disorder over here. So in this section, primarily we focused on the symptomatology of the tic disorder. What are the particular symptoms that are collaterally present in a patient who is suffering from the tic disorder? So that is the end of this section. Thank you for watching sqadia.com.